Hello. Welcome to Kaiser's Diablo Service Area Cardiac Rehabilitation Program recording. This is Kathy Malone, our RN. Our other three RN care managers are Debbie Gilbo, Kemi Covarubia, and Lisa Lutkiss. At the end of this presentation, you will see the names and phone numbers for each of us. As you follow along and listen, please take note of any questions you may have and or any clarifications you would like. You can either call your care manager or send a secure message. Again, the list of care managers will be at the end of this recording. I will be referring to the Cardiac Rehabilitation Program patient workbook that was recently mailed to you. I want you to feel free to pause anytime you need to take a break, and I will be letting you know as I end each section so that would be a good place to have your pause. Okay, here we go. So welcome to Cardiac Rehabilitation Program. This is a program for patients that have had a coronary artery disease event. And we are here to help you. And as registered nurses, we have protocols that we follow where we are able to talk to you about your exercise, your diet, your vital signs, your lab results. We can adjust medications according to those numbers. Okay, so today's agenda, we're going to be talking about introduction and burning questions. So the burning questions, we really want to make sure that we meet your needs. This is the basic education today. And as you go through your journey, please do not hesitate to contact your care manager and ask questions. You can, again, either call us or email us, and the contact list will be at the end of this recording. What is coronary artery disease? Risk factor modifications, cholesterol guidelines, and blood pressure guidelines. We're also going to talk about cardiac symptoms, excuse me, exercise guidelines, resistance training guidelines, medications, dietary guidelines, and program follow-up. Again, there's your cue for burning questions. Write them down. We are more than happy to help. So what is coronary artery disease? Here's a picture. So you can see your normal artery on the left. The pink arrow is your blood flow. And you can see a lining, the very inner lining of the artery. It's kind of a beige color. And that allows nice flexibility, your blood's flowing. And then the picture to the right of that is plaque deposit. And so that is coronary artery disease. You deposit plaque, and you can see that your blood flow is beginning to narrow. And when it narrows, you may start to get symptoms. We would call that angina, which we will talk about later. So what is a coronary artery plaque rupture? You may have heard those words if you had a heart attack and went immediately to the cath lab. So here's a picture of that. So you can see the picture of the heart and the arteries that sit on top of the heart, thus coronary artery disease. And they're the arteries that feed your heart its blood supply. So you can see that the plaque has laid itself down in the artery, and it's formed like a cap. It's a little bit covered, and then the cap can rupture. And when it ruptures, your body's natural response is to send red blood cells, the platelets, which form a clot. And that clot, unfortunately, completely blocks blood flow to your heart muscle. And so what we want for you guys is what we call stabilized artery walls. So as you learn about your risk factors and certain medications, always remember you're protecting your arteries. So coronary artery stenting, for those of you that received a stent, this is what it looks like. Of course, this picture is quite large, but the stents are quite little because your arteries are very small that feed your heart its blood supply. And you can see that the stent opened up the artery wall, and now you have blood flow going through. So what are these risk factors we talk about? You can see we're going to cut those risk factors. We'll go by these one by one. So here's smoking. What does smoking do? It narrows or constricts the artery. So it just makes it smaller, and that can impede blood flow, and it can impede oxygen getting to your heart. And it steals that oxygen, smoking does. It damages the lining of your coronary arteries. So picture a piece of very coarse sandpaper inside of your artery wall and scraping on it and rubbing and breaking it open. Well, what's going to happen when our artery gets damaged is gunk sticks around. We call it plaque. And then that is coronary artery disease. So if you smoke, we have programs to help you quit, many programs. So if you want help quitting smoking, even if you just want more information on it, again, contact your care manager. If you've recently quit smoking, yay, good job. Excuse me, unhealthy cholesterol levels. We're going to go over that in a bit more detail, and just know that that is a risk factor, but we'll talk about it in more detail in another section. So hypertension, we also call that high blood pressure. When your blood pressure is too high, we call that the systolic blood pressure. That's the top number you get on a reading. And that top number, if it's too high, is going to push on the artery wall, potentially causing damage. There's a high risk for coronary artery disease, strokes, and kidney disease if your blood pressure is too high. In your coronary arteries, your brain, your kidneys, we have very small blood vessels. So again, small vessels. They don't like high blood pressure. So the goal for you is ideally less than 130/80. However, we will work with you individually based on your risk factors, meaning what other risk factors you have, as well as high blood pressure and your age. Okay. Lifestyle is the cornerstone to lowering blood pressure. Exercise, diet, weight loss, very important. Stress management is also very important. When we are stressed, our blood pressure is going to go up, our heart rate is going to go up, and we release chemicals that are actually damaging to our arteries and to our immune system and other things. And we have really great programs at Kaiser for stress management. And also, when you call your care manager, we are more than happy to talk with you about tips and tricks to help manage your stress. Medications for high blood pressure, there's a few of them, and we will work with you with those medications and your numbers to help get you at goal. And if you're thinking to yourself, I don't have high blood pressure, but I am on blood pressure medications. There actually is a reason for that. It's called heart protection, and we will go over that when we cover medications in general. So how to monitor at home. And we do recommend that you have a home monitor, because if you feel a little, I don't know, a little abnormally fatigued, maybe a little lightheaded, it's good to take your blood pressure to make sure that it has not gone too low. Too low for most people is when the top number, which is again the systolic, is lower than 100. But that is not true for everybody. Again, work with your care manager. So when you take your blood pressure at home, you should take it while you are at rest. Your feet should be flat on the floor, and your arms should be at or about heart level. The highest readings are usually first thing in the morning. So if you would like to buy a reputable home blood pressure monitor, Omron is a very good brand. At some point when you go in to see your physician, bring your monitor with you. And after the medical assistant takes your blood pressure with Kaiser's equipment, take yours with your home monitor right after. And you can see kind of where you are with that, how close. So, next risk factor, diabetes. Elevated blood sugar can damage arteries. It just loves to damage small arteries. Again, on the heart, the kidneys, behind the eyes. And so keeping your diabetes controlled is the key. Elevated blood sugar can also damage your nerves. We usually find the most common is what we call peripheral neuropathy. Your A1C goal is less than 8.0. If you do not have diabetes, I don't want you to worry about what an A1C is. If you do have diabetes, we will order that A1C with our lab work and keep an eye on it for you. But we do have a diabetes care management program that will follow you if your A1C is out of goal range. Okay, so what's next on our list of risk factors? Excess weight. So the heart has to do its work. The heart has to work harder to pump blood. There you go. More likely that you might have diabetes, hypertension, high cholesterol, or heart disease if you're carrying excess weight. The risk for those diseases increases with an increased body mass index. The body mass index can be found in your workbook. It's basically your height and what your maximum weight should be, which would be a body mass index under 25. An increased waist size, or belly fat, if you will, also increases the risk. Lifestyle for excess weight is the #1 way to go. So that's exercise, dietary changes, portion control, and resistance training. We'll talk about resistance training in this recording. But you should know that it has been shown that if you do some toning, that actually helps to lose belly fat. Lack of physical activity is another risk factor. It increases the risk of heart attack and stroke. Makes it harder to manage your blood pressure, your diabetes, and your cholesterol. Our bodies are meant to move, and when they're not moving, they don't like it. I'll be giving you the guidelines later in this recording. we have a couple sayings we love here in healthcare when it comes to exercise. One is, some is better than none. Another is, more is better. So if you'd like to take a pause now, go ahead, and then we're going to talk about the cholesterol guidelines. Cholesterol guidelines. I mean, there it is, oats and berries. So oats actually bind with cholesterol and take it out of your system because oats are a soluble fiber. There's a little tip, maybe you didn't know, or maybe you did. So here's the goals for somebody that has had a coronary artery disease event. So this goal is different than for somebody that has not. I guess you could say these numbers are a little tighter. So by now you probably received in your packet from your care manager what your recent lab results were. And so you can compare to the goal. So we want the total cholesterol less than 200, the triglycerides less than 150, the HDL, high density lipoprotein, or the good cholesterol, for women greater than 50, for men greater than 40, and the LDL, low density lipoprotein, the bad cholesterol, less than 70, and to be on a high dose statin. That is what is evidence-based. High dose statin and less than 70. And on the LDL, I'll get into more detail about what is a high dose statin when we talk about medications. So let's break it down. Triglycerides. Here's some ways that you can lower your triglycerides. But let me tell you first what triglycerides are. They're fat in the blood, but they come more from sugars, excess carbohydrates. They're linked to people that have more belly fat. They're linked to people with diabetes. So how do we lower them? Cardiovascular exercise. You're going to start seeing a trend here that exercise is popping up everywhere, right? And then cutting back on unhealthy carbs. So white rice, white pasta, potato products, white bread, you get it. Eat the healthy carbs instead, brown rice, whole wheat products. Avoid soda, fruit juices, and too much dried fruit. Avoid the sweets, cookies, candies, pies, and cakes. So about now, you might be saying, okay, this lady is a killjoy. Trust me, we don't expect that you are going to make every single solitary change that is possible in one fell swoop. We really believe in grabbing onto what changes you can make and then building on that accordingly. So you might set a goal of, you know, the next time I go to the store, I'm going to buy brown rice instead of white rice. Or I'm going to change to a whole wheat bread instead of my enriched wheat flour bread. Yes, the ingredients on your bread, the first listed should say whole wheat, not enriched wheat. We call that caramel-colored white bread. Okay, high-density lipoprotein. So if your triglycerides are high and your HDL is low, it could be because the triglycerides are pushing it down. That is one of the problems with high triglycerides. Either way, whatever reason your HDL is low, there's that cardiovascular exercise again. It works. Focus on healthy fats in your diet. What are those? Avocados, nuts, nut butters. Now, that's a serving. So a serving of nuts is about a quarter of a cup. It's not to sit down and watch a Netflix and eat all the nuts you can out of the bag. Got to measure it out. And then losing some weight, very, very beneficial. That's been shown to really lower the triglycerides and raise the HDL. So that's a win-win. Low density lipoprotein. There you go. That's the bad cholesterol that wants to damage the artery wall. And so again, cardiovascular exercise and avoiding the saturated fats. So what are the saturated fats? Animal fats, cheese, butter, ice cream, chicken skin, red meat, sour cream, et cetera, and then plant fats like coconut and palm oil. And no, coconut is not a healthy fat. It is advertised as such, but there is no evidence at all that this is a healthy fat. In fact, what we do know is that 90% of the coconut is saturated. And until they come up with evidence, we really shouldn't eat it. And then processed fats. So when you see things in a box or a package and it has fat in it, good chance it's processed. And if you have to stick your arm out the window to get your food, as in fast food, it's a processed bad fat. We recommend, ultimately, if you can, a plant-based diet. That is evidence-based to be very, very, very beneficial in protecting your heart, lowering the risk of progression of heart disease. And second best would be the Mediterranean diet, provided you don't overdo it on the fats. Some people think the Mediterranean diet is, almost drinking olive oil, and that is not the case. So either way, your care manager has lots of information, tips, and resources for you. So you make sure to ask us for those if you're interested in either of those. We'll get into more detail on diet as we move along. So we're going to move along. If you'd like to take a break, now is a good time to go ahead and take a break, and we'll resume with cardiac symptoms. Okay, cardiac symptoms. We also call that angina. So what I'd like you to do is refer to page 5 in your cardiac rehabilitation workbook. On page 5, there's a lot of information. And really the key piece is knowing what symptom you specifically had when you needed intervention. So when it came to be that you were diagnosed with coronary artery disease, what symptoms were you having? Was it chest pressure, chest tightness, chest burning? Were you shortness of breath? Did you have arm pain? What was it that you were feeling? Always be in touch with that. If you ever think you're having a heart attack, you need to get medical care right away. And so if you feel like you're having a heart attack, or if you feel like you're having, angina when you're exercising, what you need to do is stop what you are doing, sit or lie down. If you have a prescription for nitroglycerin, put one under your tongue. If not relieved in 3 to 5 minutes, you may take another tablet, and then you're calling 911, okay? If you don't have nitroglycerin and you're having symptoms that feel like what you felt before, call 911. Never drive yourself. You can take an aspirin if you have uncoated aspirin. Now, there's going to be lots of times that you feel, wow, I'm feeling something in my chest. So I'm going to tell you it's very, very normal after having a cardiac event that you will feel anything, I like to say, between the tip of the nose and your belly button. that you just notice it and it kind of makes you stop and say, what is that? That is very, very normal. So what I want you to do, this is a good conversation to have with your care manager. We can talk to you specifically about your event, any symptoms you've had, maybe a fleeting little feeling you get in your chest. We are here to talk to you about that. Okay? That's a very limited introduction to angina. So honestly, that would be a good burning question if you want more information. So we can pause now and then we'll talk about exercise. So your exercise guidelines. Why is exercise so important? Let me just tell you that first, in case you don't already know. Okay, here's just a few things that regular exercise will do for you. It will strengthen your heart pump. It improves circulation. It lowers blood pressure. It lowers your heart rate. So blood pressure and heart rate would be resting heart rate. Both of those numbers go up a little bit while you exercise. And speaking of heart rate, let's make sure that we talk about not using heart rate as a way to identify your aerobic capacity. So stay tuned on that. So what else does it do? Lowers your blood sugar, improves stress tolerance, improves your mood, helps with weight loss, lowers the bad cholesterol, raises the good cholesterol, and lowers triglycerides. It also gives you a very good sense of well-being. Our body is meant to move. Okay, so let's get into some details here. You can refer to page 14 of your cardiac rehabilitation workbook, and we'll talk about aerobic exercise, which is the same thing as cardiovascular exercise. So aerobic activity, such as walking or biking, is an important part of a healthy life. For your physical activity, we'll call that aerobic exercise instead to be helpful. It is important that you engage in a combination of aerobic and resistance training. So number one is aerobic, second would be resistance training. We do not believe you get the same benefits at all if you just do resistance training with no aerobic. So we recommend aerobic training to be at least 5 days a week, and that would be for 30 minutes. That 30 minutes is going to include 5 minutes of warm-up, 20 minutes in what we call the somewhat hard phase of the rating of perceived exertion scale, which we'll look at next, and then 5 minutes to kind of cool yourself down. We recommend that you stretch before and after you exercise to both warm up and then cool down your muscles. To get started, let's just, before we read this, let me tell you, this really depends on a few things. What was your activity level when this whole thing started? What kind of event did you have? Did you have bypass surgery? Takes a little bit longer. We want you to start by walking at a comfortable pace for 5 to 10 minutes a couple times a day. Gradually increase those walks by 1 to 2 minutes a day to reach 15 to 20 minutes twice a day. Ultimately, sustained 30 minutes or more. So stay on flat ground. Don't find a trail or hills in your neighborhood. Really start with it flat to see how you do. The key piece here is increase as tolerated. Don't overdo. There's no reason to overdo. This is a lifestyle change forever. Some of the tips that you can do is to park away, far away, when you know, go places and do a little walk before you go in. That works for a lot of people. Now, if you can't walk, because that doesn't work for everybody, maybe you have some joint problems, you can do a cycle machine like a recumbent bike if you are a member of a gym or if you are lucky enough to have purchased one. Pool exercises are beautiful. You can do elliptic machines. There's lots and lots and lots of options. There's also something called chair dancing that a lot of people really, really enjoy. And you can buy DVDs for that. You can also look on your local TV scheduling, and there's different options like one that is called Sit and Be Fit. And you really sit in a chair and you do aerobic exercise. Trust me, it's more difficult than it looks, and it's a very good way to get your exercise without pounding on your joints. Okay. So here's that rate of perceived exertion we were talking about. So you can see these ladies getting ready to go for a swim, and the scale is next to them. So this scale starts with a 6 and ends with a 19. A little background. Dr. Borg out of Boston created this scale many, many years ago when he wanted a way to measure people's aerobic capacity without using heart rate. And because of the fact that most of our cardiac patients are on a medication called a beta blocker, which blunts the heart rate response, this scale becomes very, very good. The other thing I really like about this scale is that it lets you focus on how you are feeling, what your body is doing, instead of checking a heart rate. So 6 is us just sitting, doing nothing. 19 is we are working so hard that we cannot breathe comfortably. And a 13 is exactly where we want you, somewhat hard. When you are working somewhat hard, you should be able to breathe and take a nice big 3-word sentence without going, so I can talk would be a good example. But you hear I'm getting a little winded because I got to pick up my pace a little bit to where I can talk, but I can't sing. So I can talk versus I can talk. You want to be able to get it to where it's a little breathless, to where you couldn't sing. So I can talk, breathe, but I can't sing. All right. Somewhat hard. Does that make sense? If you want more detail on that, again, talk to your care manager, and we can talk to you more about that. And if you're somebody that always used your heart rate, let us know, and we can detail that out for you. Okay. I love this saying, an obstacle is often a stepping stone. You know, a lot of people just have never exercised. It's not anything they've done. They never wanted to. And then they jump over that obstacle and they say, all right, well, let me try. They love it. We hear this frequently. And this saying goes for really anything in life. So here's your resistance training guidelines, which we also mailed you. So the table 1 in that handout really shows what event or surgery you had, and then when you should be able to slowly begin or resume resistance training. So again, if you had a cardiac event and we've put you on new medications, you were in the hospital, maybe didn't get a lot of sleep, you don't jump right back into this. Let your body heal. So you can see certainly no sooner than 3 weeks. And if you've had bypass surgery, 3 months. Let me show you a little bit more detail here. Table 2. So resistance training schedule. And so the first few weeks, you would use 1 to 3 pound barbells wrist weights, or elastic bands. You can even use your own resistance. You don't even have to use anything. Just kind of put your hands into a comfortable fist, tighten up your muscles, and go for it. And so start with 1 to 3 sets of each exercise, and a set has 10 to 12 repetitions. Stay again in that RPE scale. In other words, no big, heavy, grunting, lifting stuff. We're talking toning here. Rest a couple minutes between sets. If you've added weights and then you're like, oh, I can only lift this 4 to 6 times, you have too much weight on there, so back off. You want to be comfortable doing this. Again, we're talking toning. And in the beginning, 1 set of 10 repetitions may be too much for you. So you may even, using your own resistance, feel comfortable with 5. And you know what? Fantastic. Do that and then build on it. Okay. What else do we want to say about resistance training? Here's some different exercises that you can do. Now you can see that some of these, you probably need a gym. But the bottom 3 are ones that most people can do comfortably. However, if you have had bypass surgery, I would hold off on that shoulder press until you have done the frontal raise and the arm curl comfortably for a couple weeks. And then you would start out very, very slowly with the shoulder press. The lateral raise is also a great one. Do what feels good for you. Every other day, you want to let your muscles rest. This is a great way to go. Okay, if you'd like to pause, do so now, and then we'll resume and we'll talk about the medications. Okay, medication review. Please refer to page 7 in your cardiac rehabilitation workbook. So heart healthy medications. I always thought that was kind of funny. Heart healthy. So heart beneficial. That doesn't quite sound right, but yeah. Heart protective. That's the word I'm looking for. Heart protective medications. Okay. So you know, Kaiser uses what we call evidence-based medicine. If we prescribe a medication for you, it has evidence behind it. We're very, very careful. We have a pharmacy board that oversees all of the medications to make sure that they are safe for you. We do lab work that is needed, other testing that is needed before prescribing and during for some medications, and I'll go over those with you. So let's start with the statins. Statins are a class of drugs that are well known for lowering cholesterol. So if you have been put on a statin and you don't have high cholesterol and you're wondering, why am I taking this? Heart protection. It actually stabilizes the artery wall, reduces inflammation, and protects that artery. So even if you have low, normal cholesterol, we are going to have you on a statin because that has been evidence-based to protect. And that's what we like to do for you. So again, we want you on what we call a high-dose statin, and that's what is evidence-based for secondary prevention. You've had an event, you don't want another one. So the high-dose statins are atorvastatin, which is also known as Lipitor, 40 to 80 milligrams, or rosuvastatin at 10 to 40 milligrams. And we give you the medication that is best for you and your numbers. Okay? So they're going to lower the LDL, bad cholesterol. There's some evidence that it helps increase the HDL a little bit, but the lifestyle for that is the best. And again, it reduces the risk of a blood clot in your artery and inflammation. And so here's the sentence. People who take statins daily are much less likely to have a heart attack or die from a heart attack or stroke. That's very powerful. So there are some, potential side effects with any medication you take. So let's talk about the ones for statins. I will say that most people tolerate a statin, but we all know the internet, right? So if you get a little mild upset stomach, some gas, constipation, let us know. Those actually from the years that I've been doing this seem to be more common with simvastatin, which we don't use so much anymore. So you should be good on the two that we use. There is a risk, it's a very rare side effect called rhabdomyolysis, and that's the muscle pain. So this is not just a little muscle ache you might feel. This is a very, very intense, almost like you feel like your body got run over. I'll tell you, this is not common, and I've been doing this for 22 years, and it's rare. It's very rare. But if you ever feel anything in your body, you say, this just doesn't feel right, then you need to talk to us. You can call your care manager if you're still in the program, let your doctor know, somebody, okay? This medication works in the liver. So why does it work in the liver? Well, the liver is where your cholesterol is made. So it goes in the liver basically, and it tells the liver, hey, stop making so much cholesterol. So it's an important medication. It is currently looked at as a lifetime medication for anybody that has had a coronary artery disease event. Also, please do not use grapefruit products, so grapefruit, the fruit itself, and grapefruit juice, because they can actually make the statin stronger, which is not something you want. Okay. Beta blockers. So the beta blockers we commonly use are atenolol, carvedilol, and metoprolol. So atenolol may be called tenormin. Carvedilol is also known as Coreg, and metoprolol has two forms. The one that's commonly taken twice a day, which is low pressor, or the long-acting one that's taken once a day, which is toprol. So what the beta blockers do, they're very cardiac protective. They slow the heart down and make it more energy efficient. So stronger, steady, and definitely protective against second heart attacks. A very protective medication. There is no lab work for this medication. And I apologize. Let me go back a minute to the statins, because there is lab work for that. My apologies. So let me get back there. There we go, statins. So we will check what we call a fasting lipid panel, and that includes total cholesterol, triglycerides, HDL, and LDL, and this is a fasting lab test. We also check as a baseline your liver enzyme, your blood sugar, and an A1C if you do have diabetes. We check your creatinine and potassium, which I'll get into why that in a minute, and a thyroid test if indicated, okay? And your care manager will let you know. Wow, I'm going a little crazy here on the slides. Hang on here. Sorry, I have a wonky. Your care manager will let you know when to have your lab work. Okay, so beta blockers, no lab work, no testing. If your heart rate goes less than 50 while you are on a beta blocker, that is considered too low. We like you in the 50s or 60s, but not below 50. So again, just communicate with us so that we can adjust as needed. It also lowers your blood pressure. And so generally, we don't want your blood pressure systolic. That's top number to go lower than 100 for most people. Again, talk with your care manager. ACE inhibitors. So the ACE inhibitor we commonly use is called lisinopril. If for some reason you didn't tolerate lisinopril, which is usually because you had a dry, nagging cough, we may have switched you to a medication called losartan. Its other name is Cozar. And they lower the blood pressure, the blood vessels relax and widen. Fantastic. So it just increases the supply of blood and oxygen to the heart. Very protective medication for a lot of people. If your blood pressure is very, very low, this may not be indicated. People that definitely should be on this medication is anybody that's had a heart attack in the front part of the heart, or if you have diabetes, because it's also protective for your kidneys. Again, you can review your medications at any time with your care manager. Aspirin, the ACE inhibitors, or the ARB, the Cozar. Those also, those both need creatinine and potassium, which is why we order that test for you. Okay. They lower blood pressure, but they don't lower the heart rate. So they're very good medication if your heart rate is too low, but your blood pressure is high. And so aspirin. What aspirin does is it makes the platelets, which are part of your blood, less sticky. So remember back in the beginning of this recording when I showed you a picture of the plaque rupture. And so if your blood is more slippery, you're less likely to form that clot. Currently, aspirin is indicated for lifetime. If you happen to be on other blood thinners like Coumadin, Xarelto, dabigatran, then we may have you off the aspirin until you are off the Plavix, which, by the way, is coming next on our list. So that is, well, it's the second one in the box. Let's just talk about that. Antiplatelet medications. So along with aspirin, we call this dual antiplatelet therapy. And clopidogrel, also known as Plavix, or prasugrel, also known as Effient, or Brilinta, they're medications that prevent a clot from forming at the stent site. It's usually for 1 year, but that can vary. Do not stop that medication unless your cardiologist has told you you can do so, okay? Nitroglycerin. So we talked about that earlier when we talked about cardiac symptoms, also known as angina. And nitroglycerin is a little white pill that packs quite a punch. It really opens up the vessels leading to your heart so that your heart gets its blood flow. Again, page 5 has a lot of good information in that. And when you talk to your care manager, she'll review your medications and make sure that if you need a prescription for that, you do have it. All right, so we're having a little wonky problem here. Hang on. More likely me than anything else. Okay, so that's it for that section. So if you want to have a little pause, now is a good time to do that. And then we will jump into dietary guidelines. Okay. So please refer to page 17 in your cardiac rehab workbook. Healthy eating. Now that's the good word there, healthy, for that. And you can see the picture of this gentleman, and he's at the vegetable stand. Great place to be. Okay, so let's just dig in right now into these tips for choosing healthy foods. That's what I want you to think about when we talk diet. Because when we hear the word diet, most people think weight loss. But diet is what you eat. And an old cardiac rehab nurse that trained me many, many years ago used to say, oh, you know what diet stands for? Did I eat that? Okay, that's memory of Teresa. And so, yeah, let's talk about those tips. All right, focus on fresh, whole foods, real foods. This is a good time in your life to say, you know what? I'm really going to take care of myself. And what I put in my body really, really matters. So fresh things, whole foods, kick the processed stuff to the curb, as they say. When you're grocery shopping, look for where fresh fruits, vegetables, and other healthy foods are stored. Processed and packaged foods in boxes, cartons, and cans often fill the inside aisles of the stores. Okay, that's gotten a little sneaky, hasn't it? So in the stores, you'll find that you need to go into the interior to get certain things like nuts, some good breads, some whole grains, like maybe brown rice, maybe some quinoa. Those things tend to be in the middle of the store. And then I see some sneaky things on the outside that aren't so good. Some buttery croutons to put on your salad. Yeah, those aren't good. Okay, you get the idea. Fruits and vegetables, choose fresh or frozen. Yes, frozen veggies are okay these days, folks. They sure are. The trick is they're fresh frozen, and the only ingredient is, well, let's use broccoli as an example. Broccoli, not broccoli, comma, cheese, comma, you get the idea. Just the vegetable, just the fruit. Avoid canned as they contain more salt and sugar, and also canned vegetables, they cook out the nutrients. They cook it before they can it. Whereas fresh or frozen, it's fresh. Flash frozen is fresh. Okay, grains. Choose whole grain breads, cereals, and tortillas without the added sugars and preservatives. So whole grain things you either have to freeze or get into the fridge because you can't set it on your shelf, your countertop, and have it stay fresh. That's a good sign. It's good for you. Back to those fruits and vegetables, I wanted to say, get a really, really good variety. So get all the colors of the rainbow in your diet. Those dark green leafies. And yes, I know if you're in Coumadin, that's a whole nother game. Again, talk to your care manager. But lots of green leafy that also, by the way, has been shown to repair damaged arteries. So isn't that good as part of the plant-based diet? And then purple, so purple cabbage and yellow peppers and orange carrots, and get a variety. So the grains, again, whole grain breads. So if you're getting a whole wheat bread, the first ingredient should be whole wheat flour, not enriched flour. Enriched means they have stripped off the husk and taken away the nutrients, and they enrich it with, I think, like half of what it normally comes with in its whole state. So we don't want that. We want whole. Legumes, so cook the beans yourself, not canned or refried. All right. Actually, all of the plant-based physicians, dietitians, nurses, they really, really recommend that you keep some good, organic, unsalted beans in your cupboard in a can. That way you always know, hey, I have a plant-based meal ready to go. And then if you have some frozen veggies, there you go. You can put a meal together. Really important. Also, if you get a bag of beans, very cheap, and on a Sunday afternoon, chop up an onion, a carrot, some celery, give it a little saute in low sodium broth. Put the beans in, cover it with water. After a few hours, you will have a very nice smelling house and a very tasty meal in front of you. Okay. Soup, again, make from scratch or buy very low sodium canned soup. It's better if you make from scratch. Dairy, so if you're going to go plant-based, you wouldn't have dairy products. So you wouldn't have milk or cheese or any of those things, yogurt. But if you're not going to go plant-based, then choosing non-fat but not with added sugar is a very important thing to do. Almond milk is also very good. It's a good substitute. Make sure you get an almond milk that is about 30 to 35 calories a cup. So it's unsweetened and unflavored. Those are the good kind. And it should not have carrageenan in it. Carrageenan is a product that's used to thicken paint, and they use it to thicken some of the non-dairy milks, and you don't want to eat that. So a good almond milk. If you're going to eat meat, use lean protein as a part of your meal, not the main course. So some chicken breast. About a half of a large chicken breast is a serving. So if you chop up some chicken and make a stir fry out of it, great way to go. Chicken skin has a lot of saturated fat. And again, we want low saturated fat in your diet. I'll get into more detail on that in a moment. Oils and dressings. Make your own dressing with vinegar and oil. Do you see the little typo there? It says or oil. So it's vinegar and oil, olive oil. A little bit of olive oil and as much vinegar as you like. Avoid the pre-made dressings from the store. They have large amount of fat, sugar, and preservatives, which we don't need. Okay. Get over to the next page. All right. This is page 18. Limit your sodium. So this page says aim for no more than 1,500 milligrams of sodium per day. So there's a lot of sodium you can't count. It's like there's some in a vegetable because there's salt in the earth, right? So just stay under 2,000 is really the way to go. If you have really bad kidney disease or really bad heart failure, we might have you at 1,500 milligrams, but we're really happy if you stay below 2,000. The average American eats between 4,000 and 6,000 milligrams of sodium per day. Yes, you heard me, 4,000 to 6,000. American Heart Association says nobody should ever have more than 2,400 milligrams. So for our cardiac patients, a little less. Salt is in a lot of foods, so be careful. Read those labels, which we'll go over here soon. You can add flavor to food with herbs and spices instead of salt. And I like this little list, and there's also a tip sheet that we mailed you about adding flavor to your food with herbs and spices. So fish, for instance, if you, excuse me, I'm having a little asthma, so I'm needing to clear my throat. I apologize. So fish with dill is so delicious, you won't believe it. So try to play around, see what works for you. And then let's talk about the really high sodium foods that are best to avoid. So those are the canned foods. Now, a little while ago, it said canned soup that's low sodium was okay. So I apologize for that, you know, little glitches here and there, but just keep track of what you're having. Snack foods, they're sneaky, like chips, pretzels, crackers, salted nuts. Not good unsalted nuts that are heart healthy, but salted nuts, not good for you. Pickles and pickled foods. cheeses. Cheeses are like a double whammy because they are high in sodium and they're also high in saturated fat. Sauces like barbecue, ketchup, soy sauce, high in sodium. Cured meats like ham, bacon, sausage, salami, and hot dogs. Instant soups, packaged dinners like the old macaroni and cheese, we know. Fast food and restaurant food. Those are the obvious ones that we kind of know about. Okay, so here's your food label. Let's go over this sample label. There's also a really good tip sheet, again, that we mailed you that has more information. But I like this because it's color-coded, it's kind of the down and the dirty, so let's go through it by color. So the lime green color that says start here. All right. Serving size. This one says 2 cups. 2 cups, okay. Servings per container, 2. So that means there's 4 cups in here. So if I eat the whole container, I have to double everything that's below there because I've eaten more than a serving. And if I say, I'm only going to have a cup, I have to subtract then, divide. Okay? All right, so be aware of what you're having. That is the key point. And as you go through the cereal aisle, this one really comes alive because a lot of cold cereals, serving size, half a cup. Yeah, half a cup. Half a cup. Yeah, it's not a lot. But oats, a half a cup of oats will really fill you up versus a half a cup of kind of an empty calorie type of cereal. So be aware of serving sizes and what you're getting for that serving. Okay, so down below in the like goldenrod color area, you'll see the total fat and then the breakdown of that and the cholesterol and the sodium. So let's talk about that a moment. The total fat, we're not as worried about. We're actually pretty liberal with how much total fat you can have, provided it's good fat, like fat from an avocado, fat from nuts, or natural nut butters. And if you're interested in a fat gram budget that is specific for you with how much total fat, how much saturated fat, how much sodium you can have, you just ask your care manager and we will put that in the mail to you. Okay, so when we're looking at total fat, they sometimes have a breakdown below it. So this one is only showing you the saturated fat and the trans fat, which is a bad fat. And so if you see that, you know right away that that is not a good fat. And how do you know that? It does not list monounsaturated fat. Monounsaturated fat is your good fat. So if it's not listed under the total fat, then it's not a good fat. So what's a good example? Oh, I know, ice cream. Let's use that as an example. So if you fix yourself a bowl of ice cream, put in what you normally put in there, and then measure it, I can almost guarantee you that for 90+% of people, it's way more than a serving. A serving size of ice cream is half a cup. I know, not very much. It's 4 ounces, isn't it? Not very much. That 4 ounces has about 4 to 6 grams of saturated fat in it. For most of our patients, again, we can mail you your personalized numbers, but most should have no more than 10 grams of saturated fat per day. So if you have a half a cup of ice cream, you've had half of what you can have in a day. If you had what most people do, which is put a cup in there, you just had your entire daily amount. So there you go. There's a good example. Moving on to cholesterol. Cholesterol, actually, you don't really need to check cholesterol on your label. That gets a little crazy making because if you never have too much saturated fat, you will never have too much cholesterol. Let me repeat that. If you never have too much, if you don't have too much saturated fat, you won't have too much cholesterol because it is saturated fat in your diet that makes your cholesterol go up. There's a couple foods that happen to be high in cholesterol but very low in saturated fat, and those are eggs and shellfish. So if you're eating plant-based, you're not going to eat eggs or shellfish. But if you aren't eating plant-based and you want to incorporate a moderate amount of those in your diet, just make sure you treat them nicely. So you don't fry up some bacon and then cook your eggs in bacon grease. And you don't drag your shellfish through butter and tartar sauce and roll it in coconut and deep fry it. You get the idea. Okay. And then sodium. I think we did a pretty good job on sodium already. A good example of too much sodium is a can of soup. Most cans of soup have 2 servings in them. And most people, if they're home alone, they're going to have dinner, they might eat that whole can. And what's in that whole can? Well, about, 1,800 to 2,000 milligrams in the can. So be careful. And then total carbohydrate. So you'll notice that's not color-coded. But if you have diabetes, you should be watching your carbs. If you have diabetes and you're not watching your carbohydrates and your numbers are not where you want them in terms of blood sugars and you're trying to lose some weight, talk to us about that. We can help guide you. And then below that is your dietary fiber. So high fiber is so much better for you. High fiber is going to fill you up. It's not going to spike your blood sugars, and it's just better off for you. If you happen to eat soluble fiber, the soluble fiber also helps lower your cholesterol. So there is a tip sheet that we have given you on fiber, and you will see the ones have a little asterisk by them that are high in soluble fiber. So you can try some of those foods. That's good for you. Oops, did I go too fast here? Maybe, maybe not. Oh, nope, that's where I want it to be. So, okay, if you want to take a little break, we have just a little bit longer to go, not much. We're going to wrap it up. So if you want to just have a little pause before we do that, go ahead. Okay, a couple more things on the diet area, if you will. That is not written in the book. Caffeine. So we recommend no more than 2 caffeinated drinks per day. And that would be coffee, a caffeinated black tea, a can of soda, diet soda. So no more than 2. And water. We should have a good amount of water in our diet. It's actually a nutrient. And in that water, we should have enough so that our urine is a nice, clear, pale yellow. That's a good way to gauge it. There's all these things you hear about. You should drink this many cups, or you should drink half of your weight in ounces per day. Well, it really, if you're thirsty, drink water. Your body needs water. It will tell you when it needs it. So look at your urine, nice and pale. If it's dark, you need more water. If it's if you're racing to the bathroom after you drink water and it's clear, you probably had enough water. Okay, so if you have any other questions about diet, anything I didn't touch on, again, call your care manager. So we will be contacting you in the near future to see if you watched this video, and we'll see if you had any questions at that point if you have not already contacted us. Remember, we are here to help. We'll contact you about lab work. Please contact us anytime via phone or secure message in kp.org. And so here's the contact information for the 4 of us. I'm Kathy Malone again, and I'm in Martinez. and I cover patients that have a primary care physician either in Martinez, Walnut Creek, or Shadelands. Debbie Gilbo is in Antioch, and she covers patients at Deer Valley and Delta Fair. Cami Covarrubia is in Pleasanton, and she covers patients from San Ramon, Pleasanton, and Livermore. Lisa Letkus, she is our on-call cardiac rehab care manager, and she might be calling you to talk about lab results. If you've talked with her in the past, feel free to call her. She'll be happy to help. And she communicates well with the three of us. We're all available by either secure message in your kp.org or by those phone numbers. We have 24-hour phone mail service. Not service, recording. We work during the week, not on weekends. Okay, what else did I want to say? Again, we are really, really here to help you. Don't hesitate to contact us. And thank you for taking the time to listen to this recording. I really do appreciate it. And you have a great day. Thank you again. Bye-bye.